Citizens' Expectations for Crisis Management and the Involvement of Civil Society Organizations in China. A paper by Riza Hazmath, Timothy Hildebrandt, Jessica Tietz, Jennifer Su, and Carolyn Su. Section 1, Introduction. In one of the seminal works on authoritarian state behavior, Gies and Zahler asserted that authoritarian governments stay in power by managing the flow of news and political information to the public. This was a global truism for authoritarian states, whether in historical or geographical terms. Yet, although it is undeniable that state repression and coercion play a role in maintaining authoritarian regime legitimacy, this is not the only main explanatory variable. Authoritarian rule can be understood as a bargain by which citizens relinquish civil and political rights for economic and social security. The operative idea is that there is a social contract relationship between the state and its citizens, to the extent that in exchange for perceived or real security, citizens support that authoritarian state in its actions and behavior. The primary mechanism through which the authoritarian state reinforces the social contract is through citizenship education. In the context of China, since 2012, part of Xi Jinping's new emphasis on the rejuvenation of the nation includes constructing model citizens and public officials who strengthen this social contract. This bargain is notably visible during times of crises and emergencies, such as the COVID-19 pandemic in the People's Republic of China. The pandemic was an opportunity for the Chinese state to demonstrate the benefits of its bargain with the citizenry and to showcase the efficacy of Xi Jinping's increasingly re-centralized advanced authoritarian regime in times of a national crisis. That is, under Xi Jinping, the official emphasis on the rule of law and top-down policy centralization has only intensified. While many world leaders have praised Beijing's response, less is known about Chinese citizens' actual assessment of the handling of this emergency. In this analysis piece, we examine Chinese citizens' expectations of the state for managing a national crisis and the role of civil society organizations, CSOs, in this process, before and after the COVID-19 outbreak. We find that while the Chinese citizenry are relatively happy with the state's management of national disasters and emergencies, they are increasingly concluding that the state alone cannot manage them. Assistance from non-state actors, such as civil society organizations, is needed and demanded in a situation of a national crisis. The implications for authoritarian regimes, such as China, predicated on the state being the sole harbinger of national interests and sole provider of security to its citizens, is elucidated with reference to state performance legitimacy and the involvement of CSOs in this process. Section 2. Citizen Expectations and State Performance Legitimacy in a Period of National Crisis. Authoritarian states do not simply rely on coercion and repression to maintain control. In addition, these regimes employ sophisticated means of managing competitive tensions among political and business elites and the citizenry, while striving to secure regime stability by generating a degree of popular legitimacy. Recent scholarship on legitimation strategies in authoritarian states argue that amongst a wide range of legitimating claims, autocratic regimes generally present themselves as the vanguard of citizens' socio-economic well-being. Although instrumental legitimacy has helped some authoritarian states, for example China, Singapore, Gulf states, it does not make them immune from instability. National crises, like national disasters or pandemics, can create new vulnerabilities or expose existing problems in society. Crises can disrupt routines of bureaucratic control, become tipping points for the contestation of social contracts and increase the risk of civil conflicts. Crises can alter citizens' perceptions of the costs and benefits of authoritarian rule, thereby engendering divisions within the ruling elite and creating political instability. The magnitude of a crisis's impact on political stability depends upon the capability of all citizens to assess the government response to it, not just those directly affected. While authoritarian regimes generally restrict access to information, often for the purposes of quelling discontent and maintaining stability, in times of crisis, their calculus can change. First, Chen and Su argue that public communication of discontent will be allowed if it helps the government to detect the problem and improve public policies accordingly. Additionally, if wide variation in public sentiment about the government's handling of a national emergency exists, the state will often permit public discourse. Second, in times of crisis, the state may need to be proactive in providing the necessary information to prevent widespread panic. During crises, the need for more information in order to respond to the crisis fundamentally conflicts with authoritarian restrictions on the free flow of information that might undermine legitimacy later. Why do citizens perceive crises as such, and how does the government affect the way it, and how they handle it, is understood? Since the 2003 SARS pandemic, managing risk has been a central function of the Chinese government. As Beck argued, the nation-state no longer has a monopoly on the definition and management of risk, even as they increase pressure on the state to manage risk effectively. Globalization and development have increased the pressures on the state to manage risk and citizens' expectations that they do so. Risk is largely a function of public perception, shaped by various factors such as demographics, education, personality, and social interaction. Citizen expectations of the government in times of crisis depend on several actions of the state itself: what they choose to define as a crisis, how they frame it, and then how they address it. Both underestimating and overestimating social risks and crisis can undermine government efforts to manage crises. Citizens tend to be more forgiving if governments overstate threats than if they deny them. However, downplaying or exaggerating a crisis can create expectations for a response that the government lacks the capacity or willingness to follow through on. States can sometimes meet citizen expectations in times of crisis even without substantive responses. Lower cost and largely symbolic responses can be effective. They acknowledge the crisis, shape citizens' perception of it, and ensure their preferences are not challenged. Effective crisis management requires that governments not only have the capacity to address the problem, but also, and perhaps more importantly, manage political legitimacy. When citizens do not trust government, crisis management will fail. In democracies, trust is built through government transparency and openness, which facilitates the coordination necessary to manage crisis. However, in authoritarian polities, such as China, the lack of transparency and restrictions on the information given to citizens contributes to lower mutual citizen trust, making coordination during a crisis difficult. When denied access to reliable information, citizens increasingly turn to social media, with a high potential for misinformation and rumors. Awash with misinformation, reliance on these unofficial channels can further undermine trust in government and increase risk perception, making the crisis and threat to political stability worse. In this context, we examine two hypotheses in the backdrop of the COVID-19 pandemic. Hypothesis 1. Due to the authoritarian nature of the Chinese state, which decreases the accessibility and transparency of information, the COVID-19 pandemic will decrease citizens' trust and the ability of the state to handle emergency crises without additional assistance from social organizations. Hypothesis 2. Citizens with increased access to information sources outside state control, such as those who are more educated or who have experiences interacting with social organizations, will have less trust in the state's ability to handle emergency crises without additional assistance from social organizations. Section 3. Data. To understand Chinese citizens' expectations for managing a national crisis and the role of civil society organizations in this process, we leverage individual-level data from the 2018 and 2020 Civic Participation in China surveys, CPCS. The surveys captured respondents' attitudes toward and experiences with volunteering, charity giving, and perceptions of civic engagement. Using stratified random sampling techniques, CPCS 2018 N equals 1,402, conducted October 2018, and CPCS 2020 N equals 4,999, conducted December 2019 to February 2020, surveyed urban respondents in mainland China. IP addresses served as unique identifiers to ensure the same individual was not taking the survey more than once, reduce the potential for clustering amongst individuals, and promote a stratified online sampling methodology. Although there are concerns about using online surveys, such as the ability to have representative samples, many scholars argue that web-based surveys can be as reliable as face-to-face surveys and might help collect information otherwise inaccessible in an authoritarian context. Validity was determined based on completedness, meaning that invalid surveys left one or more required questions incomplete. It should be acknowledged that this standard survey administration practice has the small potential to add bias in the results. Due to potential sampling variances between CPCS 2018 and 2020, and the national profile of urban residents, as elucidated in the National Bureau of Statistics of China's 2018 Statistical Yearbook, models not reported here were tested with both weighted and unweighted education variables. In particular, the sample contained a higher ratio of respondents with advanced educational attainment. Thus, respondents with less education were weighted more heavily. Nevertheless, we did not find any significant variations in our results pertaining to the analysis presented in this article, and more specifically in the information reported in Tables 2 to 3. Since the CPCS 2020 occurred just before and during the COVID-19 outbreak, we disaggregated the data into two parts. With January 20, 2020, when the Chinese government officially announced for the first time the virus was transmissible through human-to-human contact, a marker of delineation. It is plausible that individuals could have known about variants of SARS were spreading as early as December 30th, 2019, via Li Wenliang, a Wuhan-based ophthalmologist who raised flags about early COVID-19 infections. These claims were erroneously dismissed by Wuhan authorities in early January 2020. Thus, for analysis, we conservatively utilized January 20th, 2020 as the cutoff date for marking the commencement of greater public awareness of the existence of COVID-19 in mainland China. The CPCS 2020 Wave A, before and including January 20, 2020, has 3,114 responses, and the CPCS 2020 Wave B, after January 20, 2020, has 1,185 responses. Table 1 offers the summary statistics. To test Hypothesis 1, we focused on one particular measure. Respondents were asked, does the government need help from social organizations for emergency and disaster responses? Respondents were asked to rate their sentiment from 1, strongly agree, to 6, strongly disagree. For Hypothesis 2, we analyzed the relationship between this question and the following variables: gender, age, marital status, number of children, Communist Party membership, education, employment status, annual household income, and previous volunteer and charitable giving experiences. Section 4. Results and Discussion. Compared to those in CPCS 2020 Wave A, Wave B respondents were statistically more likely to agree with the statement that the government needs help from social organizations for emergency disaster response, confirming Hypothesis 1. See Table 2. To complete this analysis, we used a difference of means test with unequal variances, dividing respondents into two groups based on the date of survey completion. While the difference is not very large in real terms, it is nonetheless statistically significant, with CPCS 2020 Wave A average sentiment at 1.7 and Wave B average sentiment at 1.62. In other words, after January 20, respondents' average response more strongly agreed that the government needed help from social organizations when responding to disasters and emergencies. The COVID-19 outbreak effect is the most plausible explanation as to why Wave B more strongly agreed with the statement than Wave A. When compared to CPCS 2018, the contrast in response becomes more pronounced. The average sentiment among all respondents was 4.39, meaning that respondents on average disagreed with this statement. This average response is again statistically significantly different from respondents in CPCS 2020 Waves A and B, as confirmed by the difference in means test. We also used ordinal logistic models to further explore these findings. See Table 3. This analysis compared the probabilities of response options amongst the respondent groups, controlling for gender, age, Communist Party membership, education, household income, and participation in volunteer activities. The odds for a CPCS Wave B respondent selecting less than strongly agree were 55.87% lower than CPCS 2018 and 2020 Wave B respondents. Compared to CPCS 2020 Wave A alone, the odds for a Wave B respondent selecting less than strongly agree were 14.06% lower. The results reinforce that respondents who completed the survey after the announcement of the COVID-19 outbreak had a statistically different response to this question than earlier respondents, even when controlling for other demographic variables. To test Hypothesis 2, we used a chi-square test of association to determine if there was a statistically significant association between this measure and the following variables: gender, age, marital status, number of children, Communist Party membership, education, employment status, annual household income, and previous volunteer and charitable giving experiences. See Table 4. Besides date of survey completion, only two demographic factors impacted how respondents answered this question: level of education and prior volunteer participation. Higher levels of education appear to be associated with stronger agreement that the government needs help from social organizations when responding to disasters and emergencies. Amongst respondents for CPCS 2020 Wave B, the level of education had a statistically significant association with how respondents answered. Respondents who had completed tertiary education more frequently selected strongly agree, 72.4% within this group, compared to respondents with lower levels of education. The relationship between higher education and an increasing willingness for social organizations to play a role in times of crisis can be a result of two factors. First, increased exposure to formal education provides greater awareness and potential understanding of variations between state-led and citizen-led conceptions of active citizenship and community building. Put plainly, the increased number of years for formal education means individuals have greater exposure and awareness of the efficacy of civil society organizations. Second, there is a strong relationship between higher levels of education and critical citizens in the context of China. This suggests that more educated citizens may have a more expansive view of the role of the state and civil society in everyday life. Perhaps most surprisingly, our results indicate participation in volunteer activities was associated with less agreement that the government needs support. There was a statistically significant association between whether respondents volunteer and how they responded. Based on percentages, respondents who volunteer in the CPCS 2020 Wave B cohort selected strongly agree less frequently than those who do not volunteer. This result was similar for respondents who volunteer in the CPCS 2020 Wave A cohort. A difference in means test confirms this relationship. In both Wave A and B, volunteers had a statistically significant lower average response. Logistic regression modeling for CPCS 2020 confirmed these findings. This analysis compared the probabilities of response options among volunteers and non-volunteers, controlling for gender, age, Communist Party membership, education, and household income. Respondents who volunteered were 1.466 times as likely, or 47% more likely, to agree with that the government provides sufficient help to disadvantaged groups. Respondents who volunteered were also 1.309 times as likely, or 31% more likely, to agree that social organizations are required to assist disadvantaged groups. It appears that while, in principle, citizens who are more educated see the potential for civil society actors to have a complementary role with government in times of emergencies and disasters, those who actually volunteer with and have meaningful exposure to civil society organizations have gained a healthy skepticism of their efficacy in their capacity to undertake this role. Section 5. Implications and Conclusion. The key takeaway is that overall, Chinese citizens have increasingly seen a role for CSOs in times of crisis. Civil society groups can share information and take care of emergency needs unmet by an overwhelmed government, and can be trusted more than government-organized entities at times, such as the Red Cross Society of Hubei, which mismanaged donations and failed to distribute supplies during the recent pandemic. We surmise that there are 3 reasons for that account for this dramatic shift, each requiring greater causal exploration for future studies. First, under Xi Jinping's rule, from 2013 to the present day, China has fostered an increasingly difficult regulatory environment for CSOs to operate, yet citizens have become increasingly active in volunteering and charity giving to a number of causes, ranging from poverty alleviation to disaster relief to disability management. Notwithstanding, respondents who have previous volunteer experience were less likely to indicate that Chinese government needs help from CSOs in crisis response. We suggest this apparent contradiction is afforded due to a lack of trust between state and NGOs and varying subnational institutional environments and behaviors that our data is not able to capture in an acute fashion. Second, the capacity of Chinese citizens to assess the government response to a crisis has increased dramatically. This is evident by the fact we find that the more highly educated cohorts in our sample are more likely to support the role of CSOs in a crisis response. Theoretically, this is partially due to the idea that increased education can lead to a higher risk perception, that is, higher educated cohorts have more knowledge and greater insights into the risks of contemporary society. Third, even before COVID-19, Chinese citizens were becoming wary of the Communist Party's response to public health crises. For example, early failures in addressing HIV in the 1980s and 1990s included a combination of official denial, slow response times, inadequate surveillance, and a lack of reporting and treatment facilities. The SARS epidemic in 2003 followed a similar pattern. Guangdong provincial health experts knew about an unknown viral illness as early as mid-December 2002, but did not share the news publicly until February 2003. Journalists and newspaper editors were arrested in April 2003 for spreading rumors and for publishing official documents related to SARS, speaking to the power and potential pitfalls from the perspective of the state, of traditional and social media, as White and Fu warns us. Fearing news about SARS would damage foreign investors' confidence as well as the reputation of the Guangdong government. Local officials tried to stop the flow of information despite the public health risk. After the SARS epidemic debacle, the Chinese leadership was well aware of the importance of being proactive and provide transparent and timely information in a crisis. Indeed, Xi Jinping eventually encouraged local leaders not to hide new COVID-19 cases. However, despite some limited successes in information transparency, the COVID-19 crisis highlights the same patterns from HIV and SARS incidents, with the inherent authoritarian institutional instinct kicking in to control the narrative at both the local and central levels. Between the end of December 2019 and January 2020, the China National Health Commission sent 3 teams to Wuhan to collect evidence of COVID-19. Each team was stymied by local officials seeking to present a good image of their local jurisdiction. Dr. Ai Fen, a physician at Wuhan Central Hospital, shared the SARS-like results of her test with hospital authorities, but was subsequently reprimanded, akin to Li Wenliang, for spreading rumors and causing social panic. Experts were told by hospital leadership that there was no human-to-human transmission. As a result, the virus escaped containment and became a national and global epidemic. In each of the health crises, we see local authorities trying to restrict information and the central level seeding doubt about the origins of COVID-19. Theoretically, a crisis such as COVID-19 can alter citizens' perceptions of the costs and benefits of the state's rule, thereby creating cracks between state and society. The Chinese context does not point to this being a reality at present. Seemingly, more educated citizens are able to assess the government's response to national crisis and have concluded that the government have a leading role in this respect. But there is room for civil society actors in a complementary fashion. Those who meaningfully interact with civil society organization, in other words, volunteers, are skeptical about their organizational ability to fulfill this function. In other words, the political legitimacy of the Communist Party of China is not challenged by allowing CSOs a greater role in crisis management, or, to wit, to allow more citizen-led volunteering. As Karl Lowenstein, analyzing the nature of autocratic states prior to World War II, writes, "We must always bear in mind that human institutions share the imperfection of the human mind." Chinese citizens are keenly aware of the imperfections of the autocratic response to disasters and emergencies. They continue to have extremely high degree of trust in the state's capacity. Nevertheless, Chinese citizens are now widely accepting of the key role that CSOs can play in crisis management, and simply look to them at these times without any direct criticism of the state implied. Authoritarian leaders who include CSOs in crisis response are more likely to be able to both win citizen trust and convert a good response into narratives of competence to retain and sometimes even gain performance legitimacy.